Get ready to be jolted out of the ordinary and into a world where conversations are charged with intensity and facts. The Lightning Strike Talk Radio with your host, Mohammed Fahim, broadcasting live from the heart of the city on Chicago's Progressive Talk Radio, WCPT 820 AM. Welcome to a radio show that charges through the airwaves with an electricity like no other. Here's your host, Mohammed Fahim.
This report has just come out. I don't know if you guys have read that or not. It is shameful.
Yes.
And the Republicans are jumping on them. Oh, these are how the Democrats are. Yeah, look at your own wheelhouse, man. Look at what your president is and who your president is. We got a convicted felon as our president, and the Republicans are jumping on a state rep position over here, saying, oh, bad, so bad. Okay, 8:45, actually it's 8:46. We are gone a minute over. I want to welcome Dr. Salaman Sagarwala to the Lightning Strike. If you could please unmute yourself and let us see who you are in person. Okay.
Hi, good morning.
I see you now. Okay, good morning and welcome to the Lightning Strike, Dr. Sagarwala. We've got our whole team over here. Melinda Patino is actually Mike Patino, Chris Hilbert, and we had our guest joining us today for our District Watch segment, Maggie Wonderly and Lynn Casey Maher from the Illinois Progressives. Maggie is the chair with two legs only, okay, no four legs. We discussed that, right, Maggie?
Two-leg chair.
Okay, chairperson actually. Jokes aside, folks, this is your show, okay? This is not a commercially produced show. We don't have any commercial sponsors. We don't take corporate sponsors. We talk to you directly, people to people. Dr. Sagarwala, please introduce yourself.
Sure. So my name's Dr. Sagarwala. I'm the founder CEO of the Pain Vascular Institute. We are a medical center in Fox River Grove that focuses on treatment of a lot of chronic pain issues, a lot of neck, low back, and joint related pains. So a little bit about my background. So I'm a dual-boarded anesthesiologist, interventional pain physician. And my partner, who should be joining here shortly, Dr. Samir Ahmed, he's a vascular interventional radiologist. And so, our practice over the years has really integrated together. We worked in different hospitals together, myself, Dr. Ahmed, and we've noticed that there generally has been quite a big void between basic conservative treatments for chronic pain. Let's take knee pain, for example. A lot of people have arthritic joints. They have that aching, throbbing sensation in their knees from time to time, and it can be quite function limiting for some folks. I'm sure a lot of your listeners may deal with some of these issues on a regular basis. And traditionally, a lot of the treatments have been from the conservative side, things like physical therapy, anti-inflammatory medications, cortisone or gel injections. And then it jumps to a total knee arthroplasty or a total joint replacement, quite an invasive surgical option. While that's still the gold standard of care for arthritis of the knee causing severe pain over time, a lot of folks really are not keen on jumping to that, big open invasive surgery. There's a long recovery time afterwards. A lot of younger folks in their 40s or 50s may have to take time off from work. And then we know that these implants only last a finite period of time, maybe 10, 15 years, and then you have to have a revision joint replacement. So specifically, one therapy that we've really been early adopters of is called musculoskeletal embolization. For the knee, specifically, this is called genicular artery embolization.
I got a question for you over here.
Yeah, sure.
Okay. Why do you guys come up with these long-sounding scientific names? Why did you say knee pain?
Yeah, I wish if it was up to me, I would have come up with something much simpler.
And I guess Dr. Samir Ahmed has joined us, and I just renamed him so that we get to see who he is. But please continue.
Sure. So we were just talking a little bit about embolization treatment for knee pain. Now, this is a way that we can actually turn down inflammation in the joint without having to repeatedly inject a steroid into that joint.
That's good. Yeah.
This is how this works is when you have inflammation in a joint, you get these chemicals that are released that actually lead to sprouting of new blood vessels to supply that area. We call this, another big long word, neovascularization or formation of new blood vessels into the area. And what this does is these new blood vessels actually serve as conduits or pathways for more inflammatory chemicals to get into that joint and cause those signs of inflammation, the achy, throbbing pain, the swelling, maybe there's a little redness, change in coloration of the joint. And with embolization, we're able to get into these small little blood vessels and inject a certain medicine called an embolic, which actually collapses or prunes away these small microscopic blood vessels that just serve or feed inflammation into the joint while leaving the normal blood flow to the joint alone. Now, this procedure or this technique has been out for about a decade or so. We've been doing it for the past 7 years, and the data that we have thus far has been exceptional. Our success rate is about 70 to 80%, and the duration of relief is not in the weeks or months. It's generally in the 2 to 5 year mark.
Wow.
So this is a long-term durable treatment option that we have evidence to support in medical journals. And most insurance companies do cover this for patients. Medicare and commercial payers will cover this treatment option. The challenge has been that not a lot of individuals and even healthcare providers are not even aware that this is a treatment option available. So that's been a big challenge and hurdle for us, really, just getting out the knowledge that this is an option available and we have durable kind of evidence to support it. And on top of that, it doesn't burn any bridges for you. You know, once you have a knee replacement, you can't go back from that. That tissue has been operated on. With embolization, you can still pursue other treatments if you so choose. Maybe it's a cortisone injection or gel injection, or maybe down the line you do want to pursue something surgical. It doesn't preclude you from any other options, which I think is very important to note. It's also a very safe procedure. Okay. The risk of complications is less than 2%. It's extremely rare for any adverse effect in all the data that we have looked at this last several years.
Okay, so it's so wonderful to hear this because you know and I know that the third leading cause of death in America is medical negligence or medical intervention.
Sure.
And for someone to come in and say there is like a 2%, chance of something not really going according to plan, that is awesome. Why is this not being discussed in medical conferences across the nation? Why are doctors being resistant? Is it because they make more money replacing knees than having to do this?
Well, there always are some, ulterior motives. Our healthcare system is a fee-for-service system. So, these bigger surgeries and bigger interventions certainly do pay more to the hospital or facility and such. But I think generally the limitations have been lack of knowledge and understanding of some of these treatment options. These have been around for about the past decade, but a lot of the data has been coming from Japan. They have been the first country that's actually utilized this technique, written the papers, published, and shown the outcomes.
Yeah, I think
It's
because Japan is not their FDA is not paid by these people. Most of the FDA members are people who are lobbyists who
Mhm.
go back and who have been paid by these pharmaceutical companies and they come and sit on the FDA. Yeah, Japan
Mhm.
does not have that. So no wonder the information is coming from Japan.
Yeah, a lot of innovative medical techniques do come from Japan, even with endoscopic spine surgery, endoscopic spine cases, which don't reimburse well in the US. But I think those are great options for spinal stenosis or back pain as well. But embolization, I think that this has become more prominent in the last 6 to 12 months or so. In the next year or two, you will definitely hear more about this. It'll become more commonplace where you'll hear about it referred to something akin to like a steroid injection or a gel injection. Uh, Dr. Ahmed is actually one of the kind of leading pioneers of this kind of procedure. He's a principal investigator in a multi-center clinical trial, one of the largest in the world. So he can speak a little bit more about the procedure technique. We do this for other areas of joint related pain from arthritis, as well as other areas of soft tissue inflammation. So tendinopathy, plantar fasciitis, or pain in the bottom of the foot, a few different areas.
Awesome. Thank you so much for explaining that, Dr. Sagarwala. And we got Dr. Ahmed on, looking fresh on Sunday morning. And the format that we have started now with this Zoom format is so unique. We are the only show in the entire country who's doing this. So we get to have a nice video of our guests. We get to see them, look them in the eye and ask tough questions. And the audio is going directly to the station transmitters, and you're being heard all over the Chicagoland area and worldwide on the Heartland Signal website, and of course on our Facebook page also. So Dr. Ahmed, welcome to the Lightning Strike. I am Mohammed Fahim. We got our team of Chris Hilbert, Mike Patino, Ms. Hernandez, and in the second hour we'll have Congresswoman Murray Newman and Maria Muzaffar joining us to discuss things as to what is happening in our country. But if you can please continue the conversation. And folks, if you want to join the conversation, we got about, you guys mind staying with us for another 10 minutes? Because we do take a station break for the NBC News at the top of the hour. But our Facebook Live continues, and we can have this conversation being recorded that we can play back on other media also. So, educate us, Dr. Ahmed.
Thanks for having us. So I want to introduce myself briefly. I'm Dr. Samir Ahmed. I just give you a little bit of background. I'm from New Jersey. I grew up in New Jersey, went to medical school at Johns Hopkins, and then did my internal medicine training at Yale. Then went back to Johns Hopkins Hospital to do my residency, and then came to Chicago. My wife is from Lincolnwood in the Chicago suburbs. So we moved to Chicago, and I did my vascular fellowship at Northwestern. And I started this center with Dr. Sagarwala because we wanted to provide innovative, minimally invasive treatments, as he's mentioned. And education is a very important part of what we do. There's a lot of patients that don't know about embolization because no one has talked about it. And like Dr. Sagarwala is saying, there's been a lot of clinical trials in Japan and now in the US at big centers, University of Chicago, at UCLA, NYU, where they've shown very consistent results with success rates over 70% and persistent results from this procedure into the 2 to 5 years range. And, I kind of equate this to a revolution that happened in cardiology. Back in the 80s, and before the 80s, everyone was getting a heart bypass, a cardiac bypass. Whenever they had a blocked blood vessel in their heart, you'd have to cut open their chest, do an open heart surgery and bypass the area of blockage. And something incredible happened in the late 80s, early 90s, where they started doing these very minimally invasive procedures where they go in through a little pinhole size incision, go all the way up to the blood vessel and open that up with balloons and stents. And I think this is a good analogy to what's happening in the treatment of arthritis and joint pain and inflammation, where we want to move away, not completely, but there are other options available besides getting open joint replacement surgery. So some of the joints and conditions that we treat, for example, for the most popular one, the one that has the most amount of clinical data and probably we've done the most amount of procedures on, is the knee, the GAE procedure. But we also do this for the shoulder for various things like frozen shoulder, which is very common, chronic rotator cuff tears that are not going to be repaired with surgery. And also for bad arthritis of the shoulder. For the elbow, one of the most common procedures that I do is for tennis elbow and golfer's elbow, which is also known as medial and lateral epicondylitis. For the hip, we do it for bursitis and arthritis. And as Dr. Sagarwala mentioned, we also do it for plantar fasciitis and Achilles tendinopathy. And the general idea, like he's mentioned, it's basically turning down the inflammation and resetting the clock. So when you were younger, your arthritis was not as severe. You had some inflammation in your joint. If you had a tough day, like you played sports or you worked out or what have you, but you would rest, your body would reset, your body would be able to get rid of the inflammatory chemicals that have accumulated in your joint space. And the next day you would feel a lot better, or 2 days later you'd feel a lot better. But these inflammatory chemicals cause these abnormal pathways, these abnormal blood vessels to form over time, and they increase over time. So over decades, the amount of chemicals that are getting into your joint space has significantly increased, and your body can't get rid of those chemicals fast enough. Therefore, your arthritis worsens and your symptoms are also a lot worse. Your pain, swelling, discomfort, limiting your range of motion. So, what we're doing here is basically breaking that cycle, resetting the clock, so as if you had the pathways of a much younger version of yourself, where now your body gets a little bit of inflammatory chemicals and you're able to wash it away. And it's as if you set back the clock several decades.
That makes so much sense. That makes so much sense because my main criticism of the medical establishment and the medical facility, I've got 8 doctors in my immediate family, okay? I almost became one when I was going to college. They're always practicing medicine.
Mm.
I mean, if I go to a auto garage and say, I'm practicing putting brakes on your car, sir, I'm not going to go back to them again. But it is all about just masking the pain, not getting to the bottom of it like what you guys are trying to do, is understanding the physiology behind it, not just the pharmacology aspect that other medicines are doing.
Mhm.
They tamp down the pain, and then the pain comes right back. Okay, we're going to increase, from 2 ibuprofens to 4 ibuprofen every 4 hours. That is not treatment.
Yeah, absolutely. And I think this is something that's been a big shift in pain management in the space overall, where we're moving away from, simply masking the pain with medications, whether it's opioids or other medications, steroid injections that can work very temporarily, and trying to understand the pathophysiology and address the root cause of the symptoms. Fixing it with embolization, decreasing the blood flow to the joint, or other interventions that we're doing for the spine as well, ways that we can decompress the lumbar spine without removing too many of the vital soft tissue structures that are actually important for the stability of the spine, and allowing patients to have improvements of some of the symptoms from compressed nerves without having to undergo things like spinal fusions that have their own, can of worms with quite a high failure rate over time.
Yeah, your body is very smart, right? So the less foreign material you put into the body, the better it does. And the more foreign material you put in, the worse it does, right? So that's why a lot of these open procedures where you're putting in large prosthetics, etc., may not be the best thing for the body. These are the procedures that the ones that we're talking about, they basically are minimally invasive, and there's less foreign material put into the body, and it allows the body to heal itself.
You're talking my language. This is what I have been advocating. I know that you guys have just come on with us, but a few weeks back, I had a complete rant in my monologue on when you go to the doctor, the first thing that they ask you is, do you need a refill? And I wrote a Substack article on this. Not as to what your diet is, have you been exercising, none of those things. Do you need a refill? Okay. When God made us and sent us down on this earth, there's a verse in the Quran, guys, which says, "لَقَدْ خَلَقْنَا الْإِنسَانَ فِي أَحْسَنِ تَقْوِيمٍ," that I made man in the best of, best possible things imaginable. We don't come down with all of these things. We mess ourselves up by our diet and our social interactions, all of those things. Medical science just masks these things, and the pain comes right back. I'm so glad you guys are doing it. A couple of quick questions before Congresswoman Marie Newman joins us. How do you do this procedure? I mean, is it through a targeted on-site injection, or how do you do this? If I have a frozen shoulder, for example, how do you do it?
Dr.
So it's done in a very minimally invasive way. So, for example, for the shoulder, We would make a little tiny hole in the skin right around your wrist area. It's so small you can't really see it. At the end of the day, you go home with a Band-Aid. And all the procedures that I've described for whether it's the knee, the hip, the shoulder, it's done in a very similar way. Just the access point is a little different. So for the shoulder, for example, we go in through a little blood vessel in your wrist. We use our very microscopic, tiny tools to visualize the blood vessels around your shoulder with our special camera. We go into those abnormal blood vessels that we've discussed, and we inject a very safe medicine that specifically cuts off the blood supply to the abnormal blood vessels and preserves the normal circulation throughout your shoulder joint, which significantly decreases those pathways that are bringing in the inflammatory chemicals, the bad agents into the shoulder joint. At the end of the procedure, you just have a little Band-Aid. You go home the same day. This is all done under what we call conscious sedation. So you get a little bit of medicine to make you feel like you're getting a good night's sleep. Dr. Sagarwala, who is a dual board certified anesthesiologist and pain doctor, he is actually our anesthesiologist on site for all of our procedures. They're done at our outpatient vascular, state-of-the-art vascular facility. And this is also something that's unique to our specialty. There's almost no other outpatient center that provides full anesthesia and vascular care at one site. So at the end of the procedure, you just have a little Band-Aid, you go home the same day. Your recovery is immediate. We tell you resume all your normal activities. This is not like a joint replacement surgery where you have to undergo months of physical therapy, you have to be on bed rest and all this stuff. No, you resume all your normal activities. In fact, the more active you are, the better results you get with the procedure. And the patients typically tell us within 2 to 4 weeks, they're feeling, significant relief of their symptoms. And what I tell patients is that by week 8, you should get the maximum result from your procedure, and that result should last you at least a year, if not 2 to 5 years.
That's
Oh,
so
that's so
awesome,
cool.
especially with an aging population that we have. We've got a couple more minutes to go, and I want to bring in my team of Mike Patino and Chris Hilbert. Chris, you just wanted to say something.
Yeah, I just a quick question. For those in other states, is there somebody, how do we find somebody local to where we live
Yeah, Chris
instead of
joins us from Dallas,
Texas?
Texas, actually. So that's why she's asking that question.
And I'm of what do they call it? A woman of a certain age. So, I've got a damaged shoulder here that might help my shoulder. So I'm very interested in somebody local
Yeah, stop
that
wrestling
can
with your
help me.
husband,
And I'm sure other
Lynn.
people also want to know, how do we find somebody like you guys locally? Is there a website that has a list of people doing this embolization procedures?
Chris, you flew up for our dinner the other day on Wednesday, so
Yes.
you can fly up to get your shoulder fixed.
Well, I know, but
Okay.
time,
Well, let's let the
time.
doctors answer that question. Please go ahead, guys.
Not
Yeah, I don't know
everybody
if
can
Dr.
fly to
Ahmed maybe
Chicago.
has more insight to this, but it's something that is not done as commonly as you would expect. It's been becoming more common the last, 12 months or so.
Right.
And what's really unique is that our practice is quite unique, even across the country. There are really not many. I can't think of any in Chicagoland area where there's a collaboration with interventional pain and vascular interventional radiology that's actually able to screen and diagnose these patients properly, and actually offer those treatment options under one roof.
Okay.
So,
Yeah,
so it is quite unique, but Dr. Med can speak more to, finding any kind of local provider for these treatments.
yeah, I
Thank you.
think the things to look out for, Chris, would be one, you want it to be done by a board certified interventional radiologist like
Right.
myself. You want it to be done by someone that you actually see in clinic, someone that you go to see, and they are the ones who are going to be doing the procedure, and they explain it
This
to
is
you.
Chicago's
And
Progressive Talk, 820 AM,
Okay, we're coming back
WCPT.
on the radio, so they just jump in without telling me. You, Mr. Dillon, you should be telling me this. Okay.
Dylan.
Congressman Murray Newman has also joined us. Good morning, Murray.
Good morning. How is
Okay.
everyone today?
Oh, we have had such a wonderful
Good,
conversation
thank
with
you.
these two doctors. I am usually not impressed with the medical professionals because they're always practicing medicine, okay? These guys have impressed me with what they're trying to do. It's almost like having a stent put in, right? That's what you're describing as to how the medication works.
Mhm.
Uh, it is just unbelievable. Uh, we want more people to know about this. We On our show we don't take any commercial advertising, but we might take an ad from you guys and start running it because more people need to be aware of this. And
It's
when we
amazing.
do something on the radio, we go back and put these on 6 different socials so people can go back and listen to the messages. And it takes a while before it starts getting into people's brain. Like, I had 4 people that I know in my immediate family who went in for hip replacement and knee replacement surgeries recently. I wish I had known you guys earlier. Murray, these guys are doing things which are unbelievable. Before your guest joins us,
Sure.
I want you to hear them recap what we have been talking about. You guys want to recap in the next couple of
Please,
minutes, and then we go
please.
with our rest of the segment here.
Dr. Med, you want to give a little recap for
Yeah,
embolization?
sure. So basically, what we're talking about is a unique, minimally invasive procedure. It's been around for about, over a decade now, and it's called embolization, and more specifically, genicular artery embolization for the knee.
Hmm.
Embolization is basically a technique where you go into abnormal blood vessels and stop the blood flow to the abnormal blood vessels. What happens with arthritis and bad joint disease, for example, in the shoulder, the hips, the knees, your body develops abnormal blood vessels which act as pathways for inflammatory chemicals, bad agents to get into that joint space.
Yeah.
Once these chemicals get in, they cause worsening of the arthritis, but they also cause your symptoms, pain, swelling, discomfort. They limit your range of motion. And there's also a feedback loop that causes more of these pathways to form, more of these abnormal blood vessels to form over time. So you can imagine you're stuck in this bad cycle and the pathways are increasing over time. And therefore your arthritis is worsening, your symptoms are worsening, and you're stuck in this bad cycle. So what we do is in a very minimally invasive way, with an incision the size of a pinhole, something you can't really see, you just put a Band-Aid over. We go in, we find these abnormal blood vessels, we inject a special medicine that specifically cuts off these abnormal pathways and preserves the normal circulation in your joint. And what that does is it basically resets the clock. The
Hmm.
inflammatory chemicals significantly decrease in your joint space. Your arthritis slows down, and you get significant pain relief, less pain, swelling, discomfort, increased range of motion. And the success rate of this procedure is very high. It's about 70% in all the clinical trials that have been done throughout the world. And the results are very persistent. So you can get up to 2 to 5 years of pain relief. And if
Hmm.
needed, you can have this procedure repeated. Just in case you fall into that 30% where the procedure doesn't work for you, it also doesn't preclude you from getting any other type of treatment, whether it's steroid injections, gel injections, joint replacement, etc. But
Right.
this has become a very popular option, and not a lot of people know about it yet, but it's becoming very popular for the treatment of bad arthritis in the shoulders, the elbow, hips, knees, and even for plantar fasciitis and Achilles tendinopathy.
Oh my gosh. That sounds great. Can you do it multiple times? Meaning, like, let's say it does the pain revisits after 3 years. Can you do it, 5 times over the span of your life?
Yeah, absolutely. Absolutely. It's actually great for patients who are younger, who are trying to avoid a joint replacement, because we know
Right.
joint replacement only has a finite life, right?
Yep.
So it's going to last you 10 to 15 years. If you're a runner, you're in your early 40s or late
Mhm.
30s, and now you have bad arthritis of your knee, you get that joint replaced. We're all living up into like our 70s and 80s now, right? If not
Right.
more, you're going to need that joint replaced maybe 2 to 3 times, right? So
Yeah.
this can buy you several years before you need that joint replacement. It's also for elderly patients who are, either too sick or are not good candidates to have a joint
Right.
replacement. And it's great for people in the middle. Like most of our patients are in the middle where they're, They're middle aged. They're still working. Don't want to be off from work for months at a
Yeah.
time, and they
What is
want
the
to avoid a
recovery on
major
it, doctor?
procedure. I'm sorry?
What is the recovery period on that?
Immediate. So basically, it's an
Oh,
outpatient procedure.
Yep.
You walk in, you walk out, and we tell you to resume all your normal activities the next day.
wild, wild.
Yeah.
That is
So
life-changing.
yeah,
Yep.
so I was actually equating it to, in the 80s, there was this big shift from getting open heart surgeries to getting coronary, angiograms with angioplasty and stenting.
Right.
That is the type of shift, kind of like this
Yeah.
monumental shift that's happening from getting major joint replacement surgeries every time you have some arthritis to getting these minimally invasive procedures that can provide great pain relief for years.
Yeah. Well, that sounds revolutionary and changes the game forever because that is the recovery period. I actually have a friend who is getting his knees replaced next week, and or one knee, and then another. My sister had them done at both time and the same time, which is unusual, right? Um, and it did help her because she got beyond it because she was worried about if she did one, the recovery was so long she wouldn't do both.
Right.
So it solves a lot of people's problems in terms of working and recovery and all of that. So thank you so much. It looks like my guest is here, so I'm going to thank both the doctors
Yep.
and
Thank you
Mohammed.
so
Thank you
much.
for bringing them on. This is important, so we will
I'm
talk
telling
about this
you,
again.
Marie, this is such important information. I wish more people would get to know this, and
Yeah.
we
Oh my
want you guys
gosh.
to come back and do some things regularly to educate people over here because this is so important for us, not just as consumers, but the medical establishment does not want to promote it because, hey, you know what? Knee replacements make more money for the hospitals.
Yeah.
Okay, thank you both for joining us, and we will be in touch. And I want to welcome Daniel Laspada to the Lightning Strike. Good morning, Dan. How are you?
Good morning. Great to be with you all.
Good morning, Alderman. So, welcome to Ignore at Your Risk segment where we talk about things that are not always talked about in the news. I'm so pleased this morning to have